This is On Diversity, a podcast series by the Institute of Policy Studies, Singapore. This is the third season, and I'm your host, Liang, Kaixin, Associate Director of IPS and also a former journalist. So this episode is on social workers burnout. Today we have Cindy Ng, Director of Melrose Home at Children's Aid Society and a social worker by training. We also have Louis Ng, Member of Parliament for Nee Soon GRC, who has raised many questions about the welfare of social workers in Parliament. Welcome to the podcast today.
Thank you for inviting us.
Thank you.
I'll just start off with the study by the Singapore University of Social Sciences. So it revealed that close to 60% of professional social workers were affected by anxiety and almost 50% experienced depression during the peak of COVID-19 in 2020. So I think there's this issue about social workers seeing increasing caseloads due to the pandemic. Why is there burnout occurring despite measures to help the profession? I think I'll go with Cindy first.
Burnout is not an issue that is unique only to the social work profession. I think the whole society felt it during the pandemic, so things became worse. But having said that, burnout was also a big topic, before the pandemic. So it just made it even. It was worsened during the pandemic when resources were lesser, and also when situations were more dire. It is a few things. I think we need to make a distinction between burnout and compassion fatigue. So burnout is emotional exhaustion because just too much work and you just have little motivation to continue with work. And then compassion fatigue, which is then unique to frontline professionals who have to interact daily with families or individuals who are suffering. So it is a big topic typically among social workers about compassion fatigue, where you are psychologically affected when you continuously interact with individuals who are suffering. So that is major, and organizations sometimes put in different psychological support for their staff in order to manage compassion fatigue. Now for burnout though, there are a number of things that have been put in place, like government has given sufficient resources that are allocated to specific industry that is well known for high workload. And also there are various foundations that are funding hopefully adequate resource to support services that are primarily driven by professionals. There are many other factors that we need to take into consideration, like whether the service model is accurate, i.e. that we are delivering what we set out to do. Because if you don't, then you're not measuring the right thing, you're not making the right impact, then naturally your professionals will feel tired, discouraged, and they would not be able to create the impact that they have set out to do. So that will then drive burnout as well. So a good employee capacity estimate is necessary, and a good service model is also important. So there are a number of different factors that we need to consider. Yeah.
So Louis, you have been asking this question in Parliament, whether in person or in writing, and I think there was this answer that these social workers, they handle an average of 22 cases. So what's your take on this, and what's your reason for pursuing this issue quite many times in the Parliament actually?
I think that's the main point I think that Cindy has been pushing as well. It's across the sectors, different sectors, that there is burnt out. But if you look at other sectors, there is some protection in place. So again, teachers, we don't have a teacher teaching a class of 100, for example. There is a hard cap, again, to make sure that teachers can teach effectively with all the kids, have enough time with each kid as well. Even if you look at doctors, speaking up for them as well, there's this crazy limit of 80 hours per week they work. And so at least there are some measures in place to ensure that we don't exceed what someone is capable of. But if you look at the social work sector, there really isn't this cap at all. And when I looked at it, I realized again, there's so many programs out there, but I think the social workers are so burnt out that a lot of programs are not as effective as they can be. And if you go back, that's really why I looked into this in the first place. I have a lot of children who are from lower income families in my constituency, and I wanted to see how we can help them. And so we deep dive, and again, as I realized, there's so many programs. And what is lacking really is the manpower. There's compassion fatigue. They're really burnt out, and that's why I decided I would speak up for them so that they can be more effective in what they're doing. And that's really what the social workers want to do. And that's why I push for more a research officer, for more community work. These are things that social workers feel they can do to make a more effective difference on the ground.
Okay. So what are the reasons behind the lack of manpower and high caseloads in Singapore?
So the reasons for high caseload and a lack of manpower, I mean, simply because most who have exited the industry don't come back.
Okay.
That's the first part, unfortunately. So there is really, you see that those who usually they would work for about 5 to 8 years and then they exit the industry completely because it's just impossible after a while. And because it's also a primarily female-dominated industry, right? So you can see where then the complexities of gender inequality actually comes in as well, because then the ladies need to care for their children, they take care of their elderly parents, and you would see a natural dip. So this is consistent across all industry, and is felt even more in a social industry which is primarily female-dominated. So that these two are the key issues that the industry does face. It is not so much about ramping up sufficient critical mass for social workers, because that has changed dramatically in the last decade to 15 years actually. That when I first started out about 2 decades ago, it was like there were only like 40 of us who graduated from our cohort. And this time round, we see like hundreds and hundreds of people and make multiple pathways to actually be equipped with the necessary professional knowledge. So it's also not about critical mass suddenly. It is about sustainability. Yeah, so a number of things probably that are not unique to social work profession, but can also benefit the social work profession. It's policy reviews about how women can continue in the workforce. That's one. And also the issues about gender, the gender inequality among the society, that's the other. It can benefit the whole society, but the impact will be felt a lot more in the social work industry. High caseload is a very tricky issue. The greatest dream we could all have, right, is that everybody's caseload is low, because the community itself, they're helping one another. I mean, isn't that your dream as well for Yishun? Like, right, Louis, that if communities all step in on their own to help one another, and the assets and the gifts in the community are enabled to a point where professionals are working in partnership with the community, either agencies or not even agencies, just neighbors or informal support network, maybe caseload will drop, and then or people don't get so nervous that they call for professional help at the first instinct. They step in first to help. I give a very interesting example where I receive calls from members of the public that says that, I see this person at the corner of the building crying. Can you send a social worker down to talk to the person? And I'm like, you're there, right? Just walk up. Why don't you consider walking up to the person and asking, what's wrong? Can I help you? Right? So perhaps maybe people are fearful, they don't know what they're doing, they're worried, and maybe we haven't had that culture of just being more embracing of maybe individual of others that are slightly different from us. So with that kind of community, I think we can see a drop in caseload, and I think that would be most ideal. So I think a drop in deficits, like people with not having zero problems, is not possible. There will always be problems. But a community that is well supported with sufficient networks to support one another, that is what we want to see. And then that can directly be connected to a drop in caseload.
That really is a community work that a lot of social workers want to do. And as I shared in my speech in Parliament, a lot of them unfortunately say this is their CCA.
Okay.
In a very strange situation where a lot are doing casework, which means they're really trying to bandage a wound that is continuously bleeding. And then it bleeds even more and even more. A lot of social workers starts to quit and resign, and it's just a vicious cycle. Right? And that's why I push one for the research work, specific funding for more research officers, because we're sitting on this whole mountain of data that could tell me, for example, in my 200 series, there's an increase in child abuse. So we step up, do a lot more awareness, or there could be an increase in divorce rates, for example. We step up with a lot more programs on the ground to try and address this issue, so there will be less casework. But the key really was that comwork element, and I think social workers so desperately want to do that, which is, as Cindy said, really going out on the ground, getting the community to help each other. Before MOH could tell me a family had COVID, we had our community on the ground telling me that this family had COVID, we should send our care pack over. And I see how much faster it is cutting through all that red tape. I could have residents telling me there's another kid. Children telling me another kid is sniffing things and we should go in and help again. So before you go to the stage where FSC comes in, the child protection comes in, they get sent to a place of safety, I could then go down on the ground to deliver some help to the kids and asking why are you sniffing this and how we could help them. And if you look at it, then it's this overall picture where ultimately it reduces the casework. If we could have social workers on the ground, getting the community engaged, empowered, ultimately the casework would reduce. It will take some time, but as I said, I think we're at this critical stage where I'm just worried that we are hitting the tipping point already. There's some FSCs that I speak to that they want to send their junior social workers for training, but the junior social workers have no time, so they get the senior social workers to do in-house training, but the senior social workers are all quitting. I look at them and I don't know what to do. It's this horrible, and no senior social workers want to come back. And then they're not stuck, but they have a whole group of junior social workers that they're looking for someone to sort of lead them.
Yeah. I think you also can't learn if you're under so much stress, right? So like a lot of the times when, there was one season of my career where we were trying to very hard to calculate employee capacity estimates. So it was quite, thinking about, because when you talk about ratio just now, right, we're really talking about what's humanly possible, right? If let's say this set of professional knowledge and then you calculate how many hours can you realistically put in without killing the person. So I tried doing that one season of my career and it was very difficult. But there are many HR professionals who can do that. And we can actually learn from cross disciplines, just to try to see how we could do that too. We use some of the other knowledge to try to give a good estimate. And one of the things that I remember having conversation with one of the consultants that we have was that, he said to me that you need to pack, for example, like if a day has 8 hours, you realistically only expect maybe 6 hours of really good work, like really output. The 2 hours are like, you kind of maybe drift off, you do something else, you connect with people, or you go for training, right? So if you are doing more than that, you lose your capacity to absorb more knowledge and to actually learn and to intentionally use what you have learned in your work. So when these are some of the things that actually may seem very maybe random, but they are very, very important, especially in the frontline work.
I think there are quite a lot of reasons, right? Like just now we were mentioning about community work and all that. So if there's too many cases, then they will be loaded with too many cases. Social workers are quitting. There must be some reason why there's not enough retention of these workers, right?
Right. I think that it is, to be fair, the reasons for poor staff retention will vary from organization to organization. So that is, to be fair, different contributing factors. But I've always said that there will always be a few that you could fall back on to just go back to these big buckets and see whether this is one reason for your particular organization. So one is, of course, a service model. What impact are you trying to create, and are you accurately delivering the impact? So if, say, I want to deliver a childcare service, am I really delivering a childcare service, and what quality am I aiming? So once you can get that impact statement clear, your deliverables clear, that is first the key. So do you have a clear service delivery model? And number two, do you have at least a good guess as to what kind of capacity your employee have? So what is a good employee capacity estimate? And this has to take into account reasonable estimates based on the kind of the competencies of the staff that you have and the kind of training and learning development that you could give to your staff to upskill. So that's the second part about employee capacity estimate. With that, then you can accurately and realistically determine, right, with your current staffing and manpower and resources, can you actually meet your outcome? Then if you know that you can't, then don't aim so high, right? Then you have to adjust your impact. If you really want the impact, but you don't have the resources, then you have to go and pitch for adequate resources from different stakeholders. It could be the government, it could be foundations, it could be corporate, it could be volunteer mobilization. So then you can make sure you have sufficient resource allocated to your service model. But that also means the other thing which a lot of social services don't really do that well in, it is actually doing fundraising.
Oh, okay.
Comms, communication. What exactly are you doing? Corporate comms, right? Which, you would be better than us about this area of work. Like, do we do good enough corporate communications to consider, to sell to people what we are doing, to get people coming behind us when we are trying to do the work, and to get sufficient resource. So it's systemic. So you can see that it's not just about the pandemic. Neither it is just about churning out more professionals. It is really about what are you trying to do? Good estimate, and you need the right resources, but the how to get to the right resources require expertise such as corporate comms, fundraising, and volunteer mobilization. So these are some of the things that organization can take as big buckets and then review and say, okay, so what is going on in my organization? Have a good hard look at it so that you don't end up, I suppose, barking up the wrong tree. Yeah.
Louis, what have you learned from speaking to social workers also?
Well, I learned that they're very passionate. I think a lot. This is one of these rare dialogues where often until midnight, the social workers are still talking.
Okay.
And I see again that they're very passionate, but they're very frustrated. And that's what's killing the passion. And they're frustrated, again, because they really do want to help their clients. They want to help the family, but they just don't have enough time. So you mentioned the average, maybe 20, 25, but on the ground, it looks like it's 30 to 40, which means they just have so little time that they just feel that they can't help these families enough. And that's why they're getting frustrated, and I guess, again, some are leaving. And it really does boil down to an issue of resources. So, the organizations can do their fundraising, but I've been pushing at least government can help as well. So we really provide one head count for the research work position. That's quite clearly insufficient because the number of cases, right? The amount of data we have is really a mountain. And I don't think one person can properly analyze it. And of course, I've asked for the head count for community work. Same, we have that, but not enough. And I think we can help. Government can help in that way to put some resources in to help this sector that is, I just feel again at the tipping point. If not past it already, to be very honest.
Yeah. I think it's also looking at the cohort, right, of the professionals that are really at a tipping point. So I was sometimes just imagining that if I was at this tipping point a decade ago, I would have quit, because at a 10-year mark, you have enough to contribute, but you might not have enough, I suppose, bandwidth or even foresight to see that actually things can improve. So that's why a lot of the younger cohorts are quitting. So it's easy for me to sit here and then also talk about this because, been there, done that. I've seen 2 decades, and I've also come to a point where I've seen how things can change. And that kind of longevity of the work is important to keep things going as well. But I was not burnt out 10 years ago. Right, I was given more space, more support, and that got me through my hump in that sense. And once we can get professionals through their hump, they can stay longer. So it is also about, if we ever had, I'm not sure whether there have been some research on at which point, is the peak which we have to push through with supporting the professionals before we can have longevity in their professional career. So that might be a good angle to look at as well and to study, so that we could then target, right? Because there's so many of us, but you can target the particular group that really is falling out the most, and then create more impact in the industry in that way. The same goes for, I think, any other industry like nursing, or which are more frontline. So whether we could then target those particular key spots where people turn around.
So it's more about emotional support because they tend to experience a lot of trauma from their clients and all that. So what kind of mental support or like well-being safeguards and all that are there for social workers?
Right. There are generic services that organizations can buy, which are not cheap, but then I think maybe actually government can consider subsidizing this part. I think they will, or maybe through the funding, encourage organizations to actually set aside a funding for, or segment of the funds for this, which is you can secure support, psychological support for psychological first aid, Or you could train some internal staff to do it. Although usually it is not recommended that if I'm part of the team, I shouldn't be doing the psychological first aid. So that's the first part. The other is the Employee Assistance Program. So the EAP, commonly known to many organizations, where they provide therapeutic support, so therapy for frontliners. So that's very, very helpful because a lot of your own issues come out when you interact with individuals and families who are suffering. So many organizations pay like 3 sessions in the social service agencies, but I think in the corporate world, it seems like for some bigger companies, it could go up to 8 to 10. So that kind of services can be put in place to support the vicarious trauma that frontline social workers face. But these are not cheap. Yeah. The other bits is more HR related, where it's important to gauge, right? I mean, I know that many organizations don't have this luxury, but it's important to gauge what kind of exposure younger, newer practitioners can be exposed to, and the kind of peer and supervisory support when they are facing the work. So one of the many things that I remembered when in my very early days was that I don't recall having to deal with so many traumatic cases. Like I literally had more buffer and I could learn slowly without getting my emotional tank overwhelmed. There is very little luxury for the younger staff these days, so which is why they are very frustrated. They also happen to be the most disempowered among the workforce, right? Because they are new. So naturally, they are also frustrated with the fact that they had very little say in what they can be given. So, but that is like a chicken and egg thing. So if I've got 300 cases of highly traumatized families, if I'm going to hire young workers which are raring to go, I don't have time. They have to hit the ground. So that piece, there's no easy solution to that, but it does require a good hard look at the human resourcing and the impact of the work that will encourage longevity. Yeah, it does require organizations to be equipped with good HR practitioners to really study this particular work. Yeah.
So the government needs to put in more money, right?
I know that's what it was. This government will put more money and everything will be solved. But I doubt so.
Yeah, I doubt so too.
Again, money is one factor, but I think there are many others. And I mean, that's why I said with doctors as well, I'm very glad we set up the National Wellness Committee to look into the working conditions of young doctors. And I think that's what we need to do for the social worker sector. So not look at it as individual FSCs, but on a whole, again, what we can do as a government to help social workers, review the working hours, set some caps. Again, we're already doing that for young doctors, junior doctors, which is crazy. Again, I said 80-hour work week, 30-hour shifts, and they were breaching even that during COVID already, during the pandemic. So obviously there's a need to relook some of it, but I think there's a need to start this for social workers. On the ground, maybe I share, in Nee Soon East, now what I do is to try and empower them a bit more. We do a bi-monthly meeting where we get all the social workers from the 2 FSCs, I get HDB, police, SSO, everybody sits in, the MOS, and then we discuss some of these difficult cases. So the younger social workers have a chance to present, and then we all brainstorm together agencies and we find a way forward. So that way, again, we provide some level of support to them, and they feel, again, there's some way forward in these quite difficult cases where there's a lot of red tapes to cut. And I think so far that's worked well. We have a next meeting again next month.
So, Louis, you mentioned about doctors and nurses just now, but I think there's also this argument that actually some of the social workers, they're not recognized enough during the pandemic, right? Because they will say that healthcare workers, they were the ones who helped a lot of people during the pandemic and all that, but social workers tend to be overlooked in a sense.
I mean, the pandemic was a very horrible period, even for me. I was putting in 20 hours per day because there was just so much to do. Personally, it didn't feel like, I didn't think that the profession was not recognized. To be fair, a number of benefits that were given out to the nurses and the doctors were in part also given to the social work professionals. So I think there was some funds set up, I think, for to acknowledge the contributions. So we got that. So I think during the pandemic, there was hardly time to think whether we were acknowledged because there were so many things. We don't get into the argument, right? So, I mean, I really don't remember any of my staff, maybe they didn't dare to talk to me about it, but there was very little conversations about whether we were recognized. There was a lot of conversations about seeing, like what Louis was talking about, the community stepping up. That bit was powerful. So if anything, right, I actually would like the attention to be diverted to the community, the informal networks actually stepping up to support. Like how it was the young families in Sengkang that started the putting the disinfectant, the sanitizer in a lift, I think. It was there was so much camaraderie, right, in the communities and in the neighborhoods. And not just during the pandemic. Now, if I just throw back into history a little bit, but during the haze period, like there was a very bad season, we had haze. How many community organizations and volunteers were just out there distributing masks, right, to the elderly? So I don't get a sense about that. Maybe peripherally, maybe it happened like as fleeting thought, but what struck me more was how the informal community stepped up. But definitely, yes, there was some dialogue, I think, because about this, because I think mental health was not really a priority at the beginning of the pandemic. And rightfully so, because it was life and death, right, at that point. Not saying rightfully so, but it was natural that we paid more attention to health issues. And then there was some advocacy efforts from social workers and the psychologists and the counselors that says that, you cannot disregard this. Then the government shifted. So that bit of that advocacy, that push, it is to be expected and to be embraced. Yeah. So what I saw was actually a natural evolution of the issues that came up.
I was doing some research and then there was this Instagram account, right? SG Social Work.
Oh, that was quite a cool one. Yep.
That talk a lot about these issues that young social workers are facing. And one of the team that they talk about how they are quite adamant about social workers are not volunteers.
Oh, yeah.
And it gets mixed up. So what are your thoughts about it? Okay, I'll go to Louis first.
I guess the same, I think they need to be recognized a bit more. And I think that's the sense we get. A lot of people really do think, these are all volunteers, right? You're just helping the community as a volunteer. And so a lot more recognition. I think we did it during the National Day Parade as well. Again, not just recognize the healthcare workers, but social workers as well. But as always, I think there's a lot more to be done to get people to understand what social workers do and how they really help the community. Okay. But again, I think they're just fighting to breathe at this point.
Yeah.
There's really not much thought about how we're not recognized during the pandemic. They were just trying to survive with a crazy amount of caseload. And I mean, they shared with the media and many of the stories where, again, like the frontlines, the healthcare workers, many were in the hospitals, handling cases, go back home, change up and go back to work, handling the next case. They were working crazy hours as well. And I think that part we need to address. And then, of course, talk about recognition as well.
Yeah. I mean, when I first started out, my father said to me, I didn't pay you to go through university to do this. So that was the state of the lack of recognition 2 decades ago. So these days, hardly people say that. Actually, if people do think of social workers as volunteers, I do wonder whether have they not read the newspapers? Have they not been in contact with the world? Because it's less.
They say the horrible thing, Cindy. They'll say, "I also social worker, but I also help the community."
Oh, yeah.
It's so much less now, though. To be fair, really compared to last time. So, but of course, that's not to dismiss the current concerns as well. But it is a progression, and there have been superbly a lot of progress in the last, I think, decade, especially. I think my first decade was still. There was still a lot of misconceptions, but I think there was a lot of effort put in by the Singapore Association of Social Workers and also MSF in helping to clarify misconceptions about social work. I mean, and the Big Bangs events that we have, Social Workers Day, which started in 2012, if I'm not wrong, and also our annual, Outstanding Social Workers Award. Those are things that have been instrumental in highlighting the position and the profession of social work. So we are in a much better place and space now. It is also reflected in funding models. Funding models always indicate that you need to have how many headcount for social work position. So there is that priority. Once you do that, there is that priority given to say that to acknowledge the professional knowledge. Definitely, we are still not going to be as close to, say, nurses or doctors, because once you say nurse, doctor, nobody's going to ask you whether you're a volunteer, right? So we're not there, and maybe, yes, there's some more progress to be made, but we have made quite a lot of exceptional progress in the last decade. Yeah.
Okay, but actually, I think there are some people who may not know that you need a degree to be a social worker, right?
Yes, there will be.
From what I've seen on the Instagram account, there's a lot of, I don't know, pent up emotions, and they even, some of the comics I've seen,
They express it very well, I have to say.
Yeah, that they feel like there's a lot of emphasis on passion as a driving force for them to like give and I guess sacrifice and all that.
Correct. That is a common problem in, I think, not just social industry, but in any industry that is not profit driven, where you are expected to work out of passion. It's almost like an excuse not to acknowledge the professional work, to pay you less, for example.
Yep.
So that's real. That's very real, and probably more real in the social services because you're expected to be driven by passion, as if you're driven by a bit of money, that will make your work any less. And we never really thought about doctors, right? We know that doctors will provide high quality service regardless of whether they are in the private sector or public sector. It's a chicken and egg thing because, non-profit means that you cannot borrow money to run the organizations, right? Because it's not like in corporate companies where I can borrow money from the bank to set up something and then I test a new idea, for example, and I sell a new product. So you do need to persuade funders to buy into your product, and therefore the bargaining kind of begins. How do you show what you're doing? If you can't measure, then you can't convince funders. Resources is less. So that kind of culture and context does perpetuate this myth that you need only passion. Surely you need passion because you need people of good character, right, to be in the industry. You can't have someone with no integrity or someone who is doing it just purely for money, because anyway, there's not much to be talking about, right? But that part, yes, but it shouldn't be the only reason, and it shouldn't be an excuse to treat the professionals poorly and to not accord them the remuneration that they deserve.
But I think that's the overall society view of non-profits.
Yeah.
Again, when I was with ACRES previously, it's the same issue. When we do wildlife rescue, people say your NGO, right, should be free. But then if the snakes there, you call the pest control, you will pay $200-$300. But when ACRES come down, you say you're non-profit, right? And the same thing, your volunteers, no, actually you're full-time staff. But there's just this mindset. I think a lot of the other groups, the moving companies, for example, which are non-profit, they always say you should be cheaper, right? You're non-profit. But so unfortunately, there's still that mindset, which again, as Cindy said, I think is slowly changing.
And it gets a bit scary when it goes like, because if you're a non-profit, right, and I'm doing you a favor by using your company or your organization, and that perpetuates. It's just like, that's very condescending and patronizing, actually. So in fact, I should say that if you're going to use my company for moving, for example, and I'm actually enabling a marginalized community, you should be paying me double, right?
Yeah, you should donate more, right? To the
Not
cause.
there yet. But slowly starting, I would say, again, with ACRES, some of the government agencies, they do pay now, which I said is fair.
Yeah, so we touched about remuneration a little bit, but will this help in the retention of social workers?
I think it will help a bit, but as I said, there are many pieces to this puzzle. Remuneration obviously is one bit, which we have. The benchmark has gone up in terms of social workers' salary. But I think if you don't fundamentally solve this problem of the working environment, then I don't think we're going to be able to retain many of the social workers because they're really burned out. I see that firsthand. The same as so many of the issues that I speak up for, right? I said nurses as well, we'll give them a one-time bonus. So will it help? Yes. The teachers as well, we throw money in now. We'll increase your salary 5 to 10%.
No time to spend the money.
But every commentary will say the same thing. Yes, that will help a bit, but What about all these other the working conditions of teachers, whether there's a cap in the working hours? Everything always comes in, and that's why I say money can solve a bit of the problem, but not all of the problem.
So what I'm hearing is that the working environment is actually really important to help these social workers strive actually, right, to stay in their work and all that. But just asking about the industry itself, is it well prepared for future disruptions, like another pandemic or not and all that? Cindy?
I think we are more. I think that the pandemic was a shock. It was a rude shock to the social work industry. So it's not a season that I think many people dare to look back. The pandemic to me was a nationwide trauma. So we will continue to feel the reverberations of what was felt during that period, which was very intense. And that part where we were not digitally ready, we were not able to reach out to clients quickly. So that part is, I sigh because I think we have not even really comprehended what that did to us physically yet. So I just I need to rest. So that's the part that I think a lot of professionals may struggle to think about whether are we future proving. Realistically, of course, the leaders in the industry know that it is super important to plan during peacetime. Right? You don't wait till war, then you plan a strategy as to what to do. So pandemic was a great reminder that we need to plan and we need to be even more equipped for future future events from happening, right? So I think we are now more digitally ready, so that helps. We are also more adaptable now. I think we could shift somehow we're not without much begrudging, but we shift a lot faster now as compared to the first year of the pandemic. So I think even the workforce is now more adaptable. How that might look like in the future, I think requires us to really have a good review as to what transpired and what we could put in place for future. In particular, for a likely next pandemic disruption or even economic disruption. I think one of the things that we haven't really thought about is if there was going to be difficult political issues in a country that's outside of Singapore, and it affects supply chain, it affects our economic situation, and it affects our access to resources that we are comfortable with. So what happens then? How do we get people to sit down and plan which part of our resources needs to go first? So that kind of crisis management preparation, I think we haven't done that yet. With the pandemic, we kind of know that we're all in it together. There's no war to be worried about. So that's the other thing that that's at the back of my mind sometimes, and thinking how do we plan for a situation where if there was political instability that is not within our control, but it affects us. So what goes first? Which part of your service needs can be cut down quickly with minimum harm to the people that you work with?
Sorry, I was just wondering if my question is a bit too optimistic. Are we out of the pandemic yet? Is it? As in, on the ground, do you see less cases now, or is there more breathing spaces now? Louis?
I don't think we're out of the pandemic, but we have to learn to live with this virus now. And again, the measures are more calibrated now, but it really is about getting some personal responsibility now. Again, if you're sick, don't go to work, put on your mask. So it goes to the next phase now. But I think overall, as I always share, there were positives out of this pandemic. In that it highlighted a lot of the inequality, as Cindy mentioned. For a start, we were giving out the laptops to the lower income families, right? And then we realized actually they don't even have internet. Then we were busy giving out dongles and we ran out of that. And of course, with the migrant workers, I know they tell you that really highlighted the kind of living environments they were living in and working in. And so there were positives. The Stronger Together tagline that we did for NDP, I think that was a very good summary of how we emerged from this pandemic now. I think a lot of lessons learned, but again, a lot of things that we can do better if we get hit the next round again, which I'm sure we will do better now. Again, looking at this.
I feel like I missed out a lot of things about this topic, that there's so much complexity and all that.
What was the quote I used to? Being a social worker is easy. It's like riding a bicycle. Except the bicycle is on fire. You're on fire. Everything is on fire.
That was very well received.
I know.
So it resonates with a lot of social workers.
It was very funny. Yeah.
But I think that sort of sums it up. That's why I like that quote, that everybody thinks it's a very easy job, but they're really trying to tackle many different things in the environment, including themselves. And I think that's why as a society we need to step forward to help. It sounds strange, but to help the people who are helping us.
That's important, actually.
Yep. So a lot of social workers are coming to me saying they need a social worker to help them. It's almost like an FSC for an FSC.
Wow.
But that's how bad it was. Social workers were asking for help to get a social worker to help them.
Okay.
I think, again, mentally, physically, emotionally, they were pretty drained.
I just wanted to understand a little bit more, because you were talking about the bicycle and on the fire and all that. So other than the case, though, we all know that it's a number, right? Like the more cases you have, the more stress you'll get, right? But what are some of the issues that they are facing that is causing them a lot of stress on the ground?
If you ask me, it's really the caseload, that keeps coming up. And I think that was the first point of my speech. Be it junior social workers or senior social workers. I mean, I met one that, again, senior was in a dialogue. I think his caseload was 50 cases as a senior. And then he had to help the junior as well. So how will he have time to help the juniors? I keep saying it's this horrible vicious cycle that he doesn't have time to help the juniors. Juniors then feel they don't have any help at all. They're leaving. Ultimately, slowly the seniors will start to leave. And it comes down to the resources to manage the casework. As I mentioned, that's why we wanted to rewind back a little bit. But if you can work on the research work on the community work, and over time, hopefully that will reduce the casework. Otherwise, it's just a vicious cycle now, 40, 50 cases. Tomorrow they wake up, they go to the FSC, more cases will walk in, they have to handle. They try to close the case, which is not easy as well to close the case, and it just adds and adds and adds, and then they leave. Then the poor fellow that's left behind will get even more cases. And that's why, again, I keep saying the government needs to step in, put some stopgap measures, and then review this whole sector and see how we can do and sort an overhaul of the way we handle things.
So what Louis has just basically described is the service model. So there's a bottleneck, right? So you can't close the funnel in that sense that, the number of people coming in. So the reason why there's such a high number of people coming in, is it really reflective of what's going on in the industry or in the society, or is it a situation like I mentioned just now, because I saw this person crying in a corner of the building, and therefore, I couldn't bring myself to reach out and to kind of lend support. So that funnel just couldn't stop. That was just keep coming. So that's the first part. But the other part also is where, which Louis talked about, you try and you try to help, but what is the impact that you're making? At which point do I close the case? If it was so easy, first of all, you can't reduce the risk of harm or the risk of, say, delinquency or of problems to a zero. We're just managing it such that if things happen, people can reach out for resources and support faster. So then, at which point do you close a case per se? That has to be clear. And that takes a bit of guts as well, because if you close at a point where, of course, your assessment is poor and you make a misjudgment, then that's quite scary, right? You don't want a case, for example, to lead to a child death. But we do need some kind of common understanding as to when do you close a case that would be reasonable and that would allow a good stream of flow of, input and output in a service. So, to my recollection, a case can remain open on average of 1 to 2 years, on average. And there's a lot of deviation to this. The number of cases that can come in can be 100 per month. So at a peak of one of the seasons I was managing a few FSCs at the same time back then, it could be 100. How do you manage that? It's impossible. So, and also the other part, which is also pertaining to the risk and to the service model, is at which point do I say I need FSC help? So if I'm an elderly who is receiving a senior activity center support, do I need to refer that particular elderly to an FSC the moment the elderly says, I have suicide ideation, so therefore it's a risk? Then I jump and I go, you must refer this person to the FSC because that's where the professionals are. Then train your SACs, right, to be able to respond to the elderly without flooding one particular service, whether it's the FSC or whichever, or even the SSO or whatever. Don't flood one particular FSC model with all risk cases, because then that is just not sustainable. What we have advocated for a longest time is shared risk and shared community efforts to manage the risk, so that it's everybody's responsibility and all hands on deck when things happen. So you can't say that, you can't have a service, right, and say, my service does not cater to people who do not have any risk concerns. That's impossible. Today, there are 5 of us in this room right now. At which point of our lives are we completely without any risk? We all carry with us some possibility that we are not feeling so good, we are not happy, we might do something to ourselves, or we might have bad thoughts. So it is a collaborative effort in the community where we share the risk, and you input in your own service, regardless of what you are doing, some ability to contain the issues that the people who come to you present. So that part is a great stressor, which unfortunately, I think at this juncture, the family service centers does get the bulk of it. But it will be nice, I think, to mitigate some of the ground impact, to see more shared support for communities that are presenting with risk issues.
I guess that's what I heard on the ground. I mean, FSCs are like the sponge. They got to soak everything. And I think the study that you mentioned, it showed that FSC social workers actually have higher levels of anxiety and depression. And so that was one thing that they've been pushing for also. Say, it's like simple financial cases, not simple, but financial hardship, for example, they could just go to SSO, a social service organization, instead of going to the FSC to write a report and then refer to SSO. I think the other one that I'm fighting for is the single unweds. So now I'm very glad. I mean, we have changed our policy. They have access to housing now, but it must come with a social worker report.
Huh?
So again, the social worker has got to take
They
this.
may not have any issues, right?
Actually, yes. A lot of them have no issues other than they just need housing. If you just solve my housing, actually, I have no other issues. But they have to go to a social worker, tell their whole story. The social worker will write a report and says, actually, yes, they'll be okay to have housing. Then HDB will approve the application, which I say is, why do the additional step? I mean, they could just tell HDB
I'm a single
background.
mom, and I can have the housing.
But that... Unfortunately for the social work. I mean, that what I pushed for, and then ended up they have an additional workload to do so that they can gain access to housing. So I think that part, again, we can streamline. I mean, that's what I try to do on the ground now again. Straightforward financial cases, go straight to SSO. You don't need to go to FSC. The second thing which we didn't really push in my speeches so far is that some of the social workers was asking whether they could have specialist social workers at each FSC. Because again, the cases are not just an increase in number of cases, but increase in complexity of the case. I mean, I have one case now where the child is incarcerated, the husband is about to be incarcerated, there's some family violence issues, there's financial hardship as well. But if you imagine a junior social worker that could just graduate taking on this case, it really is quite lost. And again, there's a lack of senior social workers. So, I mean, there's this push about, and I don't know whether it increased the amount of red tape, but whether each FSC, for example, could have a divorce specialist, a housing specialist, someone that the junior social worker could go up to and say, actually, I got this problem now, and this social worker will know all about the housing policies and they can help, clear a lot of the red tape much easily. They have immediate access to HDB as an example. But that's something that has been raised. I haven't really pushed that so far because I don't think we're at this point where we have enough social workers to have specialist social workers to start with. I don't know where they're going to come from other than increase the caseload of some other social worker. So, but that's an interesting idea that we could look into, like how there's this like PAVE that focuses on child protection, for as an example.
I think, Louis, you also mentioned about the reports and all that. I think that's one thing, right? That there's too much paperwork and they don't feel that the social workers don't have enough face time actually, right, with the clients.
Yeah, I mean, I'm also pushing that, which is whether we could have more FSCs. I mean, I've pushed that in Parliament again. There isn't a hard and fast. It looks like it's more of an art instead of a science. And And so some FSCs might have a bigger pie, some a smaller pie, some, has rental blocks, some don't. And then I just, again, not just look at it on a geographical boundaries, but again, really dissect and see whether there's an even spread. And again, Nee Soon East, I have more BTOs coming up, but I don't see more FSCs coming up, I really don't. I have Yishun Glen coming up, Yishun Broadwalk, Yishun Grove Spring. And that's what I've been pushing, that at least if we can then set up a new FSCs when there's new BTOs to look after the new areas, rather than an increased workload for the current FSCs, go back to the same vicious cycle, right? Then likely there'll be more cases again.
I think we cannot take away the reality that social workers must write. They have to write. In fact, my fundamental approach when it comes to management of social workers is, if you cannot write, you don't join the industry, please. Because you have to advocate for your clients' issues eloquently and intelligently and fairly. So I can't be correcting your grammar, English, and the way you present your information. So that's the first fundamental.
Okay.
I'm very picky about that. Now, the second thing is they must think critically. So you must be able to make good case assessment, good case conceptualization, because that is key. So people who work with me, I say assessment is everything. If you make a good assessment, just like doctors making a good diagnosis, you know what to do next. So these are professional thinking, critical thinking, which cannot be replaced. All social workers must have them. Therefore, it is not about face time. To me, it's about thinking time. Do you have got time to think? Do you have time to build your professional thinking? And that is key. The admin part for the administration support needed for the FSCs is high. And I laugh also because I know that some of my ex-staff will say, that I'm responsible for some of their requirements for admin. That's because of a few things. One is one of them is that the family service centers does present with itself a service model that is very wide. So literally anybody can walk in. So you have to have a very wide lens in understanding the work. And the wider the lens, the more paperwork, right? So that is a natural need in that sense. So it is, unless the service model change, you're going to have that. So that's the first key issue. So if I am operating, say, a violence specialist center, then it's quite specific. People come in because of violence. I assess violence. I consider the other things, but it's a bit more targeted. So the FSCs has that thing which that broad scope that needs to be reconsidered. That's the first part. So that can help mitigate a bit. It is not about increasing only. It is, yes, about having time to see clients, but it's not the only thing. Because you could see clients many times, but if it's not intentional intervention, right, you're wasting your time. So every time when I see case notes and I look at, like, what are you doing? And if the case note suggests to me that you're just chit-chatting, you're wasting clients' time, you're wasting our professional time. So tell me what interventions are you putting in place every single time you meet? We are not their friends.
Sad to say.
Yeah, we can be friendly, but we're not their friends. We are not we're not their relatives. We can't be there. We need to work ourselves out of jobs. So your session, your FaceTime must be about building networks. So go into the community, build networks, write your reports that you need to get them the help that they need, advocate for policy changes so that it's easier access. Those are the good admin work that they need to put in. And the face-to-face time should be intentional interventions that are well thought through because of good professional thinking. So it is a bit of both. Yeah, I need to have more capacity to see clients, yes. I need lesser admin work, yes. But that's just symptoms of other issues.
Just to sum up, I think we hear a lot of things about resources and all that, and still we really need to reduce the number of caseloads per social worker, and perhaps we can have more FSCs, more resources, more support for their mental health and all that. Summing up here, hopefully, good enough. So thank you.
Cindy should join my team of legislative assistants.
My part-time work, is it?
To advocate for social workers.
We can discuss later.
Okay, cool.
Yeah, but I think if you don't mind me just making one last pitch, right, is for organizations to consider reviewing the 4 pockets that I repeated time and again at various platforms. I do think that there needs to be some leadership in this. I don't mean leadership from the government. So I mean, Louis has spoken a lot about what the government needs to do and can do. I'd like to speak to the sector leaders, especially if they are in charge of organizations, right? To look at the 4 buckets. It was the 4 that I talked about just now. Review your service model. Make good employee estimates, capacity estimates. Do you have the right L&D support, learning and development support in place? And what is your impact statement? What are all these? Then you talk about resource allocation. Do you have sufficient resources allocated to your service? So having some of these buckets reviewed, you know where the gaps are. And it starts from the organization. It doesn't start from the government, because government doesn't have access to all this nitty-gritty details. So I do want to speak directly to the social leaders to review these portions of the work. Yeah.
So Cindy has summed up very, very beautifully what we have said today. Thank you, Cindy, and thank you, Louis, for your time today.
Thank you for doing this.
Thank you.
Thank you. On Diversity is a podcast inspired by the Institute of Policy Studies Managing Diversity's research program. We are available on Omni.fm, Apple Podcasts, Google Podcasts, and Spotify. Please follow or subscribe to the On Diversity podcast to get notified when we have a new episode. You can visit our website, ipscommerce.sg, for more information.